I debated with myself regarding this podcast. I didn't want to speak about such a tragic event, yet I felt that some discussion was warranted. A little Black baby boy died tragically. His parents have been traumatized. We all want healing and justice for this family. It was in the news. You've probably seen the reports. Last year, a young woman with a history of gestational diabetes was admitted to labor and delivery at 37 weeks. Her delivery was complicated by a shoulder dystocia. During the attempt to deliver the baby vaginally, the baby's spine was severed. Vaginal delivery wasn't successful. A decision was made for a cesarean section. At the time of the cesarean section, the head became detached from the body. The body was delivered via cesarean. The head was delivered vaginally. I would like to briefly discuss one, the cardinal movements of labor, two, gestational diabetes, and three, shoulder dystocia. The purpose of this brief podcast is to help inform so that those that have heard these reports will understand and not be fearful. In order for a baby to be delivered vaginally, the cardinal movements have to occur. The baby has to be able to maneuver through the maternal pelvis, whose size and shape is determined by the pelvic bones. In a gynecoid pelvis, the pelvic inlet is ovoid, with the largest diameter being transverse from side to side. The mid-pelvis is defined by the ischial spines, and this is the most narrow part of the pelvic cavity. The pelvic outlet is limited anteriorly by the pubic bone, and the largest diameter at the pelvic outlet is front to back and not transverse. The largest part of the baby, which is usually the head, has to fit through the smallest part of the maternal pelvis. This happens when the head flexes and the biparietal diameter can pass through the space determined by the ischial spines. In order for a baby's shoulders to descend into the maternal pelvis, the baby has to internally rotate 90 degrees to allow the shoulders to enter in the transverse plane of the pelvic inlet. In order for the head to be delivered, the fetal head has to come up under the pubic bone and then extend. After the head has been delivered, and in order for the shoulder and the rest of the body to come to be delivered, there has to be external rotation so that the shoulder and the largest parts of the body are aligned with the largest diameter of the pelvic outlet, the AP diameter. So the cardinal movements of labor are flexion of the head to allow descent of the head, internal rotation to allow for descent of the shoulders into the pelvis, extension of the head, which comes under the pubic bone, extension of the head, followed by external rotation to allow for the delivery of the shoulder and the rest of the body. Now, if the baby is too big, if the mom is too small, or if the relative size of the baby to the mom is too large, or if there is something unusual about the shape of the maternal pelvis, the cardinal movements of labor may not be possible, meaning vaginal delivery may not be possible. If the maternal pelvic size is adequate, and if the baby is able to perform the cardinal movements of labor, you will see steady progress, descent, and delivery of the baby. Gestational diabetes, the sugar diabetes that develops during a pregnancy, can put you at risk for 1, having a large baby, 2, developing diabetes when you're no longer pregnant later in life. The recommendation for anyone diagnosed as a gestational diabetic is that they should have periodic testing every 1 to 3 years to determine if and when they develop full-blown sugar diabetes. Because having a large baby puts you at a greater risk for developing shoulder dystocia. And shoulder dystocia occurs when the head of the baby has been delivered, but the shoulders are being obstructed by the pubic bone, and the shoulders and the rest of the baby cannot be delivered. Essentially, the baby is stuck. This is an obstetrical emergency. The umbilical cord and the blood flow to the baby is being compromised, so time is of the essence. There are multiple maneuvers that can be performed, including hyperflexing the thighs and performing suprapubic pressure to bring that anterior shoulder down and under the pubic bone. And these are done to make room and to deliver that shoulder. But you should know and remember that shoulder dystocia is not very common, and not every shoulder dystocia leads to a bad outcome. Pregnant women need to be aware if there's adequate room, adequate fit, There should be steady progress in labor, steady descent of the fetal head with delivery of the body and the head. Yet, pregnant women should remember to get their diabetic testing. This is usually performed between 24 and 28 weeks of gestation. And remember, if you are someone who has experienced shoulder dystocia in the past, there is a higher probability that you will also be at risk for shoulder dystocia with a future pregnancy. It's a lot to consider. And in closing, I find it hard to find the appropriate words for the grieving family. What I will say is, we see your pain and we pray for your healing.